So when you go to college, you sometimes think, am I actually going to use this degree that I'm deciding to pursue? It's 4 years of my life. I'm dedicating all this time to learn about this general topic of one aspect of the world. Hey, my name is Brandon and I'm a new grad PA working in neurosurgery. I went to the University of Florida for my undergrad. I got a degree in applied physiology and kinesiology, and then I went to Nova Southeastern University to get my PA degree. In between then, I went to the University of South Florida to get a one-year master program to help boost my resume, initially for medical school. However, I realized I wanted to pursue the PA career instead. During that time, I was pre-med, so I wanted to go to medical school. However, I didn't want to get a degree in general biology because I saw the classes I ended up needing to take, and I just wasn't interested in taking like a botany course. Not to downplay anyone who's trying to pursue a biology degree, because I think you should do a degree in whatever you're interested in. However, I've always been passionate about fitness, nutrition, health, and wellness, so I felt like an APK or applied physiology and kinesiology degree would better fit me. So how am I using my degree now that I'm 7 years out of undergrad? Well, it's mostly for educational purposes, as well as me being a personal trainer. I can still have the ability to teach other people about pretty much everything I learned as an APK major. I'm working with a lot of spine patients. There's a lot of overlap between the musculoskeletal system, kinesiology, or just human body movements, the dynamics of it, and educating my patients on what I might see on imaging. Because what I like to do is make sure all of my patients are really educated on whatever we're talking about. When you see an x-ray, a CT, an MRI for the first time, if you're not familiar with the medical field, you have absolutely no idea what you're looking at. Because there can be a lot of stuff on imaging that might look scary, but is actually part of your normal anatomy, and vice versa. Something that might look completely normal to the untrained eye is actually something we might need to dig a little deeper in. I like to stay within my scope of practice. However, if it's general knowledge on fitness, health, nutrition, everything related to my APK degree, I try to provide as much information to the patient as possible, both brain and spine patients that I need to send to physical therapy, occupational therapy. Even though I know a little bit of more of the physical therapy side of stuff, I'm not going to prescribe them certain movements, certain exercises, or anything like that. I'm going to refer out to physical therapy because they're the masters at what they do. Say I have a patient asking questions about nutrition. Even though I have a very good grasp on it, I've spent years and years of doing my own research on nutrition, as well as learning a little bit about it during undergrad, the master program that I did, as well as PA school. I'm still going to refer out to a registered dietitian, nutritionist, get their input on it, because I don't want to step out of my scope. That's their specialty, so I want to make sure that the patient hears it from them. So that's how I still use my APK degree. Even though I got it several years ago, I still talk about it in my everyday life. If it's not on social media talking about health, wellness, nutrition, or anything like that, I try to bring it into the encounters that I have with my patients if they do have questions outside of neurosurgery.